Welcome back to Between Sessions Podcast. We are on session 4, and today we're talking about why don't Black men go to therapy. And we have a very special guest, as you can see. This is our second guest since we started, and Elisa's going to introduce him, and then we're going to get into this conversation.
Yes, our dope therapist.
Yes. Of the week.
Yes. And so I'm going to have to read real quick because you've got so many dope things that you do. But this is Dr. Earl Turner, who is a clinical psychologist and psychology professor. Go Gators. Since earning his Ph.D. from Texas A&M University, he's worked in outpatient settings and psychiatric clinics, providing therapy to children, adults, and families. His research and clinical expertise includes mental health issues among ethnic and racial groups and child psychology. And Dr. Turner has published research on these topics and often serves as a media psychologist expert for local and national sources such as O Magazine. I saw that article. I was like, know someone who knows someone who knows Oprah.
We are so much closer.
1 degree closer, right?
You know somebody that knows Oprah.
Yes. Washington Post and FOX26. So welcome, Dr. Earl. I'm so excited you're here. We're so excited you're here. Yes.
So how do we get him on the show? Elisa,
I kind of started like stalking you.
A little bit.
I was like, who is this dope professor? And he, my undergrad is at UHD, was from UHD. And I'm like, and he's talking about all these things that Melanin and mental health are talking about. Yeah. So started following you and was so excited that you agreed to, collaborate with us. So welcome.
Yes, thank you so much for being here.
Yeah.
So as we stated, today we're just overall topic is why don't Black men go to therapy? And so just to start that conversation, what are your thoughts on just that as a topic in general?
Yeah, I think one of the issues is that we sort of have therapy as being like it's a female area to sort of talk about your feelings and go seek help.
Yeah.
So because of the way we are sort of taught growing up, it's like you have to be tough. You shouldn't express your emotions. You shouldn't talk about feelings. And so therapy, the way that we view it is that you go, you sit and you talk to somebody. So why am I going to spend my time to go do that? When there are other ways to sort of deal with the stuff that's going on in my day-to-day life.
Right. And it's almost the exact opposite of everything you just said that you don't do. That's exactly what therapy is to sit down and talk about feelings with a stranger. Like that.
Right.
And so
the misconceptions of what it is.
Exactly.
Mm-hmm.
You kind of, and I'm just going to kind of skip all over the place. You mentioned like what it means to be a man. And so I'm always curious about the conversation as far as masculinity and one, just that conversation in general as a whole thing.
Yeah.
Right, exactly. Be a full podcast.
How long you got?
But especially when we're talking about mental health and when we're talking about like discussing our issues and the things that we struggle with, what's the struggle that men have with reconciling that with being a masculine man?
Yeah, I mean, I think it's changing about how we sort of talk with our young boys about what it means to be a man.
Yeah.
But the concept of sort of this rigid idea of masculinity and what we have, not just within like the United States, because I think if we look at other countries, what they do sort of masculinity norms is much different than how we sort of socialize boys. But even within the Black community, that whole concept is also such more rigid in terms of how we think about it. But I think it's changing in terms of really wanting to teach boys that it's okay to talk about your feelings. It's okay to be sad or upset, to be able to vocalize that as opposed to sort of express it out in sort of an aggressive, sort of angry way.
Sure.
Because what's often sort of taught as you're growing up is that it's okay to be angry, but it's not okay to sort of be sad. So if you have a 3-year-old that's crying, you almost hit the kid sometimes. Don't cry.
Tough it up.
Exactly. So I think that whole idea is that when you are sort of so rigid in terms of your beliefs of what it means to be sort of a man, and this idea of toughness sort of restricts the ability for men to sort of be comfortable with the idea of going into therapy where you have to sort of be vulnerable. It's a vulnerable place to be. And so how do you want to have a man that's sort of this tough guy to go into a place like that where you have a sort of space to be able to talk about it, communicate those things.
Well, the measure by what men are being judged by, which I think often shows up also when we see, couples where now there's this lack of ability for often the male clients to be able to communicate their emotions. And it's sort of like what you said, boys are allowed to be angry, they're allowed to be aggressive, they're allowed to be sexual, they're allowed to be happy, but you can't be sad, you can't be vulnerable, you can't be all those things, where women often get the opposite of that. Like, you can't be angry, you can't be aggressive, and then it's like, that difficulty in being able to connect all those parts.
Yeah. And I think one of the things that you just touched on is that we sort of talk about this idea of not sort of being vulnerable and expressing emotions and sort of being affectionate.
Right.
Those are the things that you don't want younger boys to do and some men, but then when you get older and you start being an adult and you get into relationships, it's like, this is the thing.
Yeah, what's wrong with you?
You're emotionally unavailable. And it's like, well,
yeah, nobody taught
I was taught to be emotionally unavailable. I was taught that it wasn't okay to express these certain things. And so then in a relationship, the women are like, well, express, which can be a struggle.
Right.
Which I'm sorry.
No.
I'm curious what your perspective is as, as a therapist, as a, clinician. I've heard the complaint before that sometimes psychotherapy, especially for couples, it is more sort of based on how women express themselves. That it is more of this feminine type based approach. So I'm curious as to what your perspective is or what your thoughts are on that.
Yeah, well, I think part of it, sort of the aspect of couples therapy itself is that it's working on the relationship.
Right.
But if you have a man that comes to couples therapy, oftentimes, most of them, not all, say that they're there because their wife and their partner wants them to be there, and so it's like this is an opportunity for the woman to like sort of express thoughts, and like, the man is just there to sit and listen.
What does she want me to do?
Yeah.
Right.
Exactly. But I think for me, when I've done couples therapy work, is that I want to make sure that both the man and the woman know that this is a time for both of you.
Right.
And so I think almost for me, not that I'm pressuring the man to, because I don't want to pressure them to like talk about their feelings and emotions.
Right.
But I want to make sure that they have an opportunity to do so, and that they have like space in there. So I'm always making sure that I want to check with the man first, like, what do you want to say? What do you have to contribute to this conversation, so that it's not like you're dictating all of the time to the female in the relationship. Because I think sometimes men come to therapy and it's like, well, even if I'm here, like, you're on her side sort of thing. And so I think you have to make sure that you're balanced in that approach, so that you sort of give an equal opportunities of both partners to be able to express how they feel about the relationship.
Yeah, I definitely agree with that. I feel like when I work with couples, I do tend to try to align with the man a little bit more, especially when I know that the woman is the one that has called for the appointment, decided that we're coming, this is what we need to work on. And I'm like, okay, let's focus on like, what can you get out of this? How can this also help you have a satisfying relationship? I get that if she's happy, you're happy, but also what are some needs that you may feel like you're not getting met? And so I think that that's true. You do sometimes have to play, well, that's just what you do as a couples therapist, but definitely as far as trying to pull the men in and get them more invested, and then you have to figure out what does that look like and how do I get you more involved in this process.
Making it feel balanced for both, I always tell clients, I'm neither here nor there. Like, you set your goals, you tell me what you want, which often helps people, just even if they're on the same page. But anyways.
That's all. At least I wanted to know, when we were talking about masculinity, I know there's in the Latinx community the machismo.
Oh yeah.
And so how have you seen in your raising boys? How does that factor into like the masculinity and relationships in the Latin community, or even them wanting to seek out therapy?
Yeah, I think that, the message of just being this macho sort of, the don't cry, and just what men are sort of valued for, what their role is, it can make it incredibly intimidating. It's sort of like you're not just having to deal with the factor of being you're the gender of the person, but the cultural norms, where you're going to go and you're going to sit and you're going to talk to who, and when you talk about these feelings, like, George Lopez has one of these like skits, so it's like, why are you crying? And it's like this message that every time you were a little kid, it's like, why are you crying? You get whooped for crying, So it's like there is this punishment that's involved for expressing these vulnerable emotions that can be, it can be so toxic, not just for the person that you're partnered with, but for that individual. I'm like, I think there's a reason why men pass away before women, like having to hold all this in. Mm-hmm. So, absolutely.
Right. Yeah. It's just always interesting, to the expectations of adult men versus what we teach them in childhood.
Yeah.
A lot of times conflict.
That's such a good point.
And so it's there has to be some understanding of like now they have to relearn all of these things. Mm-hmm. And try to start from scratch in learning these things that we expect from them now. And we sometimes don't give them that opportunity to do that because we expect them to be there already.
Or to do it the way maybe, someone who's already been expressing themselves or is, really socialized to express themselves, to express themselves exactly like that.
Right. Like, I know I can express myself. Why don't you do it the way I do it?
Right.
Yeah. And I think, one of the things that I try to do when I work with men in therapy is that that sort of emotional vocabulary, I think, is something that is sometimes difficult for them. And so, like, you may express, like, well, if, let's say, your partner, your wife is not at home at a certain time, and so you're getting upset, well, that's, like, because you're concerned or you want to have time with them, sort of giving them that language to sort of make that connection, which I think brings the couples together strong, but also helps them in terms of that sort of emotional vocabulary, in terms of talking about, feelings in that sort of vulnerable space.
Right. That's a good topic, emotional vocabulary.
I like that.
That's a good topic, just to,
What is your emotional vocabulary like?
Especially because I tend to think of, like, I'm not a person that uses a lot of narrative in therapy, but I do talk about, like, the words that you learn growing up and how you tend to express yourself and how that comes from, like, your childhood. And then we attach those words to other things that may not be as fitting, but that's because you don't have any other way to express what you're thinking, things like that. So anyway, okay. So discussing just therapy being more feminine, therapy kind of seeming to be more focused on women. Obviously, there are more women in the field. And then the whole concept of therapy of, sharing emotions, being vulnerable, things like that tends to appeal to more women. Are men being left out of the conversation when we talk about mental health? And what do we need to do to kind of make sure that we're reaching out to them as well?
Mm-hmm. Yeah, I think that traditionally they've definitely been left behind, and so I think we're sort of in this catch-up sort of space right now. I think the conversation within the last at least 2 to 3 years has definitely been more geared on like how is therapy useful for men, and sort of how can we sort of provide a space for men to be able to talk about sort of what they're dealing with, especially in the context of sort of what we're dealing with in society with police brutality and sort of how do you sort of cope with some of those experiences of even being like in an environment where you might potentially be sort of perceived as a threat. And so I think sort of, as you mentioned ago, sort of internalizing and holding in all of those feelings, and so at some point it has to come out. Absolutely. But it's how that's going to come out and sort of the issues that we need to sort of deal with. And so I think it is something that we're starting to talk more about, and I think it's an important conversation that needs to be had, because I would say therapy can be helpful for everybody.
Absolutely.
Definitely, I think for men, just having that being expressed to them, to let them know like this is a space where you can be able to sort of get what you need in that particular designated time period.
And seeing the value in that. Because I think, so often I'll hear men say, like, what good is that going to do me to go talk about my problems? Like, you're just going to sit here and just talk about your problems. But really getting them to understand the value in therapy, and that it's not just sitting and talking about your problem, that there's an actual process going on.
Right. And that you can get something out of it. It's not just complaining. Is what sometimes it's seen as.
And I think that's the sort of how we think about therapy and how it's been depicted, is that you kind of sit on the couch and you gotta
always talk about yourself.
Right, why are you here today, sort of thing. And I think, it can also be focusing on solutions that men tend to be very solution oriented, and so I think sort of taking that aspect of it of, how can we work with you to help you sort of solve a sort of issue, if that's your anger, if that's your relationship, if that's dealing with a coworker that you maybe don't want to be around, and being able to use that space about how you want it to sort of get something out of it.
So it's not just, how does that make you feel?
Right. And so it sounds like part of like trying to include them in the conversation is understanding what approach works best for them, and then marketing that to them. Like, I wouldn't be such a touchy-feely therapist. I don't even know what that means, but that's what people think.
Yeah, you're not gonna be feeling
right. Whatever. With men or women, but especially with male clients, like maybe yes, we're going to talk about emotions, and yes, we're going to talk about these things, but also my approach may be, like you said, more solution focused. It may be more like you control more of what's happening, strength based, those type of things, as opposed to emotionally focused, or so just really figuring out not trying to, which I think that's just the conversation we're having overall, is not trying to just put your views on that person or how you think it should be,
right,
and really taking into
consideration.
Thank you. Taking into consideration who this person is, what their experiences are, and what works for them.
Yeah.
And I think that's just in therapy. That's usually good therapists are going to use that when they're deciding how they're going to approach you and your issues. So,
I have a question that's kind of piggybacking off of this idea that it's mainly women in the field and women. What do you say though? Because, I remember when I first started off in this field, and yes, the majority of students were female. And yet what I was noticing is the majority of people in power positions were males, white males, right? And so I was like, wait, so I'm at this conference, and yet the majority of people that are serving on this board are men. So what are your thoughts on that?
Yeah, I think definitely that needs to change. I think there's sort of a shift with trying to get more women in power. But I don't know like what sort of keeps women from sort of outside of just sort of men having some level of power in terms of decision making. But I think it's helpful in terms of when we talk about sort of mental health services and how we sort of train what sort of resources we give to those particular initiatives to sort of address some of those diversity issues.
Yeah.
That it's important to sort of have everybody. I mean, having a seat at the table is important. So I think making sure that women are involved and included is helpful. But I think in terms of sort of this shift with like the training of like mostly sort of females entering into mental health field specifically, I think has been a shift. Is that you have sort of older, let's say white men, older men in general that have sort of started out and maybe dominating the field and sort of held that position.
Yeah.
And so now it's going to take time before women sort of trickles up.
Especially with it being such a new field. Like it's not like this is something that's been around for hundreds of years. Psychiatry, psychology, mental health has just been very recent. And so I remember being in school and like a lot of the people that like founded these theories, and they were like, they're all alive. Like that's it's not a field like biology or something that's just like, when you look back hundreds of years ago, they were researching these things. So, so I think that's part of it. When these people are the ones that were starting it, it's kind of like then people that follow them look like them.
Yeah.
Well,
that's sorry.
I just wanted to add when you look at sort of some of the gender differences in terms of why men may not go into the mental health field. Is that again sort of being that provider sort of idea of sort of masculinity? I think it sort of takes you away from being able to sort of do other jobs that may support you or your family. You have to sort of take time off of school. I recall I published a paper a couple of years back, sort of surveying some black men specifically about some of their views about it, and those were some of the common things that they noted about financial consideration with supporting the family, the expenses of education, taking the time away and how long it takes you to sort of go through going to school, getting additional training, all of that takes time away. So it's like I would rather get a job where I can sort of have this immediate benefit as opposed to taking time. So that's sort of a barrier.
Yeah, that's a good point. Right, that's a really good point. And I guess for me, it makes me wonder then if the theories were created by men and the approaches were created by men, and yet men are the ones that are more reluctant to come.
But it's probably created men's idea of how to fix women, because I feel like mental health again was like focused on these women that were like kind of doing too much at the time, and they were like, let's do something to fix these people. So
so we need to come up with a new model.
Right. We're gonna start from scratch.
That'll be the next project.
But I think we've talked about that a few times, like when it's hard to find that space for minority communities when minority communities weren't even really what the focus was on in the beginning. And so now we're like, even in applying these theories that we've learned, you do have to kind of take something from here, take something from there, and add your own cultural knowledge and things like that in order to make it work for your clients. And I think that's when we talk about culturally competent therapists or dope therapists, we're looking at people that, yes, we understand the theories and we get them, but we also understand that when we work with certain communities, we just can't blindly apply that to them. Yeah. Right. And so you have to be able to say, like, I understand that your experiences are different, and so how do I help you with those experiences?
And honor that.
Yes.
Honor those differences.
Right, right, because there's nothing wrong with it. It just is what it is. So. All right.
We always do this, though. We'll have the...
Right, I feel like we did 2 questions out of All right. What struggles... Oh, okay, yeah. So what struggles are men dealing with that are different than women? Like as far as going to therapy or just in life, like that therapists can be aware of so that when they do have a client that reaches out to them, what are some things that may look a little different than, I guess, when you're working with women clients?
Well, I think one of the things that we touched on a couple of times is this idea of sort of vulnerability. And so that I think it's acceptable for women to sort of be in that sort of vulnerable space, but for men, it's not. And so throughout life, you're going to have a number of situations where it sort of puts you in that vulnerable space, and so how do you deal with that? I think for men, if we couple that with this idea of sort of being the tough guy or this rigid sort of masculinity, then it's like, well, how do I deal with this sort of vulnerable situation? I'm not going to go to therapy to sort of talk about this vulnerability, and so it's like, how do I cope with all of the stress that I sort of may be under in a particular situation? So I think that's one of the issues. I think the other one, I mean, we talk about this idea of sort of police brutality and sort of the idea that you're going to be perceived a threat.
Absolutely.
So I think that's something that we always have to deal with. And so I actually, when I did a workshop last week in Columbus, Ohio, I was telling a story about I got stopped while driving black once, and so the guy asked me all these questions about what I do for a career. And I'm like, how is this related to you pulling over for no reason?
What is this ticket going to be for?
I didn't turn on my blinker.
So when I was like, well, I'm a college professor, it's like, oh, okay, so now I'm going to let you go. And so I was perceived as being less of a threat in a situation. So I think it's like, now people are going to perceive you as like being angry. We always get that. And so you have to sort of deal with that. And so how can you express your sort of disagreement or in a situation, because people are always going to sort of add that sort of attribution to you that you may not even be sort of expressing at that point in terms of sort of your emotions or who you are as a person. So I think those are like expectations that are placed upon men that they have to sort of deal with. And like, how do you sort of cope with those things? And even when you go to therapy, I think sometimes therapists may sort of assume that every man that comes to their office isn't comfortable with talking about emotions.
Right.
How do you sort of deal with those?
Which isn't always the case. I was, showed my own bias when I first started seeing clients in private practice, that I was getting a lot of calls from men, and men who they were the ones initiating the couples therapy and stuff. And so I was like, oh, okay, like I stand corrected, And it's exciting, I think. But I think I love what you said, because that's another example of maybe something that you're kind of just used to dealing with, unfortunately, and not even thinking this is something I need to process with someone, or that it's something I'm going to process in therapy. So I think it just highlights also how we don't always have to be in crises in order to have some space to process some of these things that we don't always have solutions for. Right.
One thing that I've noticed in working with men, and this probably applies to women as well, but I've noticed it a lot more with men, is the idea of code switching. Have y'all heard of that?
I have.
It's basically this idea of like you have to be this different person in different situations. And with the men that I work with, the minority men I work with, it seems to be like at work they have to be a different person, with family they have to be a different person, and then with their spouse they have to be a different person. Right. And so having to navigate this area of like switching on and off in these different areas, like we kind of said, in relationships it's expected that you're more emotionally available and things like that, but growing up you may not have been taught that. So when you're with your cousins or your siblings or things like that, you're not going to be like this emotionally vulnerable person per se. And so just knowing that you have to play, I don't want to say play, but you only can show a certain part of yourself in these different situations. And that can be a struggle to like have to never feel like you're being 100% yourself.
Yeah.
So that was just one of the things that I thought about when I was thinking of the difference between men and women. I understand most minorities have dealt with that just in general. Like when I go to work, I have to feel a certain way when I'm with my people. But then you're thinking about like when I'm with my siblings or my family, I don't feel like I have to be so different than when I'm with my significant other. But that's because it's okay for me to be vulnerable. It's okay for me to be these certain things that it's not necessarily okay for men to be.
Yes.
So, all right. So we have just been going, so I'm gonna try to wrap it. We're trying to keep these a little short. Right. We have to do a part 2 or something because I have so many more questions. But I want to get to you now and know more about you. You're a professor and you do private practice as well.
I'm not doing any clinical work right now, so my sort of clinical work is focused more on training right now. So I've been doing a lot of work in terms of training therapists, in terms of how to work with communities of color. And so that's sort of what I'm primarily doing. I'm trying to figure out how to fit a space in my schedule.
In your spare time.
Right.
You're not doing research.
You're not sleeping. I can cut down my sleep hours to 4 hours and I can see a couple clients.
So that's something that I'm trying to like figure out and how to navigate. So in the next couple of months, I may try to do like a 1-day sort of part-time practice, but we'll see.
Please let us know. we have the need to refer clients all the time. We're like, there's so few men of color who are therapists that it's like, okay, let me think.
Right.
Yeah, I got nothing.
Like my list of 4 or 5 and all of Houston, and Houston is huge. So it tends to be a struggle.
Yeah.
And so it sounds like when we talk about like how you're making a difference within mental health and minority communities, you're training people to deal with our communities.
Right.
And so that's amazing. And I feel like that I went to a conference recently, one of the Texas Counseling Association or something like that. And one of the guys was like, are you getting your Ph.D.? And I was like, no. He was like, you need to get your Ph.D. because we need more people like us training us. And I was like, I agree. Probably still not going to do it, but I completely understand. I get the need. Just don't know if that's for me. But yeah, so I think that's very important that we have people that can say like, okay, along with all these other things you're learning about, make sure that you understand this concept and how this is different as well. And so why do you think the question is why you think therapy is dope? But so why is it important? What makes it so special and just needed in our community?
And what is therapy?
Why is it dope?
Well, I mean, I said this. I think therapy is dope because like everybody can get out of therapy what you need at the time. And so I think that this idea of what we think about sort of traditional therapy is like you go in, they know what they're going to give you without sort of having this sort of give and take, which again is the problem with sort of this idea of cultural competencies that you want the client to sort of be engaged in this sort of decision-making process and sort of what their goals are as opposed to sort of telling them, well, I think you need to I think you need to be more expressive with your emotions.
Exactly. This was all of your issues. Yes.
Right. So I think being able to sort of have that sort of conversation with the people that you work with to see what is it that you want for yourself and how can I sort of help you navigate that? And so I think that's why therapy is dope. I think that's why I'm a dope therapist.
You are a dope therapist.
Because you understand that. So I know you wrote an article last year, but you just posted it recently about Black men in therapy, and you mentioned the You Good Man hashtag. Do you feel like that has helped open up that conversation even more?
Yeah, I think that was a big step. So we talked about sort of leaving men out of it. I think when that hashtag started, it definitely sort of, from a social media perspective, sort of started that dialogue where men felt like, okay, I can sort of check in on somebody that I know and say, hey, are you okay, man? Like, do you need to talk or whatever? Sort of give me an opportunity to let them in to sort of what you may be dealing with.
Right.
So I think it made it easier in terms of like prompting, to be able to kind of do that check-in as opposed to women like may have an opportunity to go to happy hour, you go to brunch, you're like, how you doing? You
all the check-ins.
You okay?
Right.
But I think for men, it's like, you're not going to talk about, you're going to talk about your week and everything else, but not necessarily sort of emotionally, sort of what you're dealing with, or what may be sort of stressful for you.
Right. Yeah.
So I think that made it easier.
I definitely think social media is helping a lot with reducing the stigma. I think, all of us have social media presence, of course, Melanin Mental Health, is trying to like make it less intimidating.
Right.
And I think things like those hashtag campaigns and just different therapists that are actually putting out information or just having conversations where it's like, oh, like we always say, they're normal. Like they're human. Yeah. Like that helps to reduce that stigma of like, if you go to therapy, it's got to be this old white man that had you laying on the couch and his back to you while he's taking notes. Like that's not what it is. It's just a conversation. Right. And so, so that campaign reminds me, just like every other big, viral hashtag or whatever, it really does do a good job of bringing up these conversations and making it a little bit more relevant, where it's not such a like scary thing to see or to look into.
And I love that I see more and more like of people in hip hop coming out and talking about seeing a therapist and the need and the therapy is dope. Essentially, like I love that it is becoming just even more of a conversation.
So I was going to wrap up, but I do want to talk about microaggressions in therapy, and I think what you just mentioned a few minutes ago about like assuming that every man isn't emotionally available, and I'm wondering, are there other things, and we can even chime in if we can think of something, probably should sometime, but microaggressions that maybe minority men, black men, Latinx men may experience when they go into therapy, how, like, are there any that you can think of that either you've heard of or experienced or anything like that? Like, off the top of my head, the first one is how we said black men tend to be perceived as more aggressive. And so maybe telling a black man how he can come across as softer or something, like maybe you should smile more, maybe you should do whatever, like that could be perceived as a microaggression, because why do I have to do that and other people don't? Right. Is it solely based on the fact I'm a black man?
Yeah. Well, I would think like discounting sort of races or experiences of discrimination. I think that sometimes we kind of brush some of those things off and sort of provide another sort of explanation about why someone engaged in a particular behavior. And so I think just being able to sort of validate that person's experience, because again, they were there, they were present in that moment. Yeah. So I think that sometimes happens, but probably often than not, that therapists, particularly those that are not of color, sort of discount some of those experiences until they sort of, I think, provides a missed opportunity to sort of connect with the client, and they sort of lead them to not continue that therapy experience.
Not knowing maybe how to approach it as well. Or, I don't see color.
That has never made a black person or a Latinx person feel comfortable just because you said you don't see color. Those words normally put us on defense.
Yeah. Like, I need you to see
it. Because it's here. Like, I'm in this color every day, so I need you to respect it and see it. And I think what you just said about the experiences is I don't need you to explain it. I don't need you to tell me why. I just need you to respect it and respect my experiences. And I think that should be our goal as therapists in general. It's like, however that person is perceived, whatever is happening, you have to respect that and then go from there as far as the conversation, as opposed to trying to negate it or tell them why it may not be what they thought it was.
To be curious about their experience.
Exactly. Curiosity is good, because that makes you more focused on them and less on your perceptions. All right, I think that's it. Do you have anything else that you want to?
I know that you've got some stuff coming up, so we want to give you an opportunity to let people know how to get in touch with you, and tell her where you're going next month. It's next month, right?
Is it next month?
I can only guess.
I have like a couple places where I'm going.
The conference.
So I'm going to Miami next month.
I knew that was it. So we're going to Miami tonight.
So there is the conference, Miami International Child and Adolescent Mental Health Conference, which is next month, and I'll be doing a workshop.
Very cool.
They're focused on sort of barriers to treatment for communities of color. And talking about, again, sort of this idea of cultural competency and how we can make therapy more dope for those communities.
Right.
And then hopefully, again, like I said, trying to get into some maybe a one-day a week sort of practice. There is a need. Since I moved to Houston 4 years ago, I think within the first couple of months I received a requests for a therapist.
Yes,
right.
For my son, and I'm like, I'm not taking any clients right now.
Yeah.
So hopefully being able to sort of do that, and of course continue my blog posts, which I focus in on sort of parenting skills and dealing with issues for parents of color, which is on Psychology Today. You can look at my website, which is drturner.com.
How do you spell that?
DRERLANGERTRNER.
There we go.
We'll have it all.
Yeah.
We'll put it all up there.
We'll have links to everything.
Yeah.
Yes.
So
and across social media.
So on it's social media, Dr. Earl Turner,
Okay.
which is on Twitter and
Instagram.
Okay.
Facebook.
My Facebook page
Is linked to this.
/
Yes. Okay.
so you can find me there.
Okay.
Awesome.
Thank you so
Thank
much
you
for
for joining
being
us.
here. I knew it was gonna be a good conversation.
Yeah.
It was gonna be a good conversation.
And we're gonna have a lot more conversations probably around this topic, just like because it's good to just talk about it and put it out there and continue to have these conversations of how we can be changing it and making it better for everybody.
And making it more making it more attractive for the next generations, to see it. But that's part of what's been so important to us is, what you talked about earlier is the code switching. And I think that was a big part of why we felt the need to do this, because it's like, I want to still be able to include all these parts of who I am. How do we do it? And I think so much of that is kind of like we said, because we didn't even say who we were, what we were doing. We were two brown chicks
Changing the face of mental health.
of therapy.
Of therapy.
You did not have your coffee today.
This is why you do it all
Two
the
brown
time.
chicks changing the face of therapy
On
both sides of the couch.
Yes. Yes. So that is what we're trying to make it more accessible, like you said, and more relevant and normalize it. So it's more attractive for people to get into the field.
Absolutely.
So we can have more brown faces being therapists,
Right.
as well as, of course, more brown faces in therapy.
And Dr. Turner, you're doing that too.
Yay!
All right.
All right. Thank you guys
Thank
for joining
you.
us. You can find us across social media at Melanin and Mental Health, and on Twitter at Melanin Health.
Yes.
Now I gotta double check. And make sure you join the Facebook group Between Sessions Podcast. If you're a mental health professional, join Melanin and Mental Health Professionals on Facebook as well. And this podcast.
Dallas.
Oh, we're gonna be in we'll be in Dallas this Friday. There's a Facebook group. There's an Eventbrite. Make sure y'all join because we are having issues with this location, but we will be there this Friday. And we'll keep you updated on where exactly we're going to be. And also subscribe, rate, comment this podcast. It is at Google Play, SoundCloud, iTunes. It should be on iTunes this week.
Yay.
And Spreaker and anywhere else you can find podcasts, and of course on YouTube and Facebook Live.
Yay.
So thank you guys for joining us this week. And we will talk to y'all next Wednesday on Facebook Live and Friday on everything else.
Stay
Bye.
tuned.
Thank you.